The Oyo State Government has appealed to journalists to carry out aggressive campaign against wrong information on COVID-19 vaccination, tuberculosis and other communicable diseases. The State Disease Surveillance Notification Officer, Dr. Tutilokwe Akinleye, made the appeal at a capacity-building program organized for journalists on the role of media in disease emergency response in Ibadan.
5,000 cases samples have been tested, and out of which we have 10,316 confirmed cases. Out of the confirmed cases, we had 10,060 that have recovered, 202 deaths. Among the cases, the positivity rate between male and female, for female 50.76 and for male 49.3. And looking at the age distribution, you see that 50 years and above are the most vulnerable. We had more cases at that age. And the positivity rate 19.4%.
In his remarks, the State Commissioner for Health, Dr. Bode Ladikbo, represented by the Director of Public Health, Dr. Olubunmi Ayinde, said the program was important for the dissemination of the right information to the society.
This is a very important program. Very important because it's an opportunity to enlighten those that will carry the good news for us and those that will advocate to our communities for us. We need to know exactly what is happening presently when we are talking about epidemic diseases and different outbreaks across the states. We need to be able to enlighten our community, and we need to give the right information to those around. And it's whatever we tell people that they will actually believe. I'm here actually is to appreciate us for all we've been doing, to appreciate us because you make the public aware of health issues, health challenges, and how to prevent themselves from it.
A representative of the World Health Organization, Dr. Philip Zotto, said that the sensitization program was in line with WHO's priority to ensure that people are well protected from every form of emergencies.
So it will be a very good forum to sensitize, train, teach, and give you right messages concerning the etiology, that is the cause of these diseases, how these diseases are being transmitted from one person to another, and what prevention measures public are supposed to put in place to make sure they are protected from these health emergencies, and not only themselves, but also make conscious efforts to make sure that the entire population of Oyo State are protected from these health emergencies. That is in line with WHO priority, is in line with the global priorities to ensure that people are well protected from every form of health emergencies.
Chairperson of the Oyo State branch of the Nigeria Association of Women Journalists NAWOD, Comrade Jade Shola Ajibola, urged journalists to base their reports on facts, data, and eliminate unnecessary fright from the minds of the public.
As media practitioners, professionals, we must have adequate information. We must source for facts. And when we are sourcing for facts, we need to reach out to the appropriate quarters to get our facts. We must source for data. As a journalist, you could just decide that you want to pick your storyline, for instance, on COVID-19, from the angle of more female contract COVID-19 based on these statistics, and you give data. But when you go and say more female have been reported to have COVID-19 more than male, without facts to back it up, then you are giving a wrong information or you are misinforming people. Another thing is that our reports, our stories must be designed not to scare people, not to scare people, not to scare the public, but to give accurate information to the public. And most importantly, accurate information to prepare their minds on what to look out for, on how to keep safe, on how to stay hygienic. These are the information we need to give.
The program was organized by the Oyo State Emergency Operations Center in collaboration with Oyo State NAWAJ, funded by the World Health Organization. In attendance were medical experts and information officers from local government areas of the state.